Welcome to Ethics and You. Today's episode, Ethics in the Daily Life of a Radiologic Technologist. And now your host, Mike Becker.
Okay, thanks. I probably don't have to work to make this any cheesier than it's going to be on its own. So let's just go ahead and talk about ethics in the daily life of a radiologic technologist. Are ethics even important in our day-to-day life? What does ethics even mean in a medical imaging setting? Well, ethics references a broad range of issues, including some that are out of scope of the technologist's position. Important decisions, such as a patient's decision with regards to end-of-life care and the distribution of healthcare resources. Those decisions are made by hospital boards of directors, legislators in some cases, and of course, private decisions made within the patient's family. However, the technologist's role in the quality of patient care is vital. Additionally, the way in which we conduct ourselves has an effect on our colleagues, our employers, and the profession as a whole. Maintaining a practice based on high ethical standards requires a thorough knowledge of the codes of ethics and understanding of how to apply the concepts to the workplace. Ultimately, the implementation of a sound work ethic is the responsibility of every technologist. What may appear to be additional work will actually result in more effective and meaningful care for every patient. Well, it's impossible to play by a set of unknown rules. As you have already found out, there's no shortage of rules in the medical setting. Every facility will likely have its own code of ethics that employees are expected to uphold. The American Registry of Radiologic Technologists, the ARRT, has a standard of ethics document that contains a 10-point code of ethics that every technologist should aspire to meet. In addition, that document incorporates a Rules of Ethics section that contains 22 mandatory standards of minimally accepted professional conduct. Jointly, the ARRT and the American Society of Radiologic Technologists, the ASRT, have issued the Radiologic Technologist Code of Ethics. That lists 10 criteria for every registered technologist to uphold. Each set of ethics is based on 4 medical ethics concepts: beneficence, non-maleficence, respect for patient autonomy, and justice. Beneficence is the duty to act in the best interests of the patient and of society as a whole. That is the difference between just knowing what the expectations are and actually putting them into practice. Non-maleficence is the duty to do no harm to the patient, or again, to society as a whole. Respect for patient autonomy is the duty to respect and protect the patient's right to make his or her own decisions about medical care. Justice is the duty to be fair to the community as a whole. Once the rules are understood, it's important to grasp how the technologist's responsibilities to different parties impact patient care. Well, the primary obligation of anyone in the medical field is obviously to the patient. Patients in turn have a right to expect that every member of the medical staff is a skilled professional. An imaging examination is an important component of a diagnosis that will help guide future decisions about that patient's care. No matter what the distractions or obstacles may be present, either personal or professional, we should always strive to provide the highest quality images possible. Of course, the image is only part of the story. The technologist is an essential link between the patient and the physician. The ability to communicate effectively with the patient is a critical part of our responsibilities. How important is it? Well, the patient's life may depend on it. The Joint Commission identifies human factors, patient communication, and patient assessment as the first, third, and fourth most common root causes of sentinel events for 2011 through the second quarter of 2012. A sentinel event is defined as an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. A sentinel event is outside the natural course of a patient's underlying condition, meaning it would not take into account a cancer patient dying from complications with their cancer, but it could include a patient death from anaphylaxis because the technologist failed to notice drug allergies on the patient's chart. I guess Lori wasn't kidding. Medical imaging is a field where the details matter. An ethical approach to care means that every patient has a right to the same quality of care and compassion, regardless of sex, race, creed, religion, or socioeconomic status. It is the duty of every staff member to respect the patient's rights for physical safety, privacy, radiation protection, and the refusal of medical treatment. Every interaction with the patient will have an effect on the overall care. Using the codes of ethics to guide our behaviors and attitudes will maximize the impact we have on the patient's care. The consideration of ethical behavior does not end with the patient. The quality of a patient's care is not determined by just one individual, but rather all involved departments working together in harmony. We are part of a team of skilled colleagues that cannot function optimally without mutual respect. This includes a willingness to share knowledge and to maintain a curious mind that's always eager to learn. An open-minded and positive attitude goes a long way towards strengthening the morale within the team. The patients will notice the happy environment as well, and in the end it will improve the quality of the care they receive. The dedication we show to our patients should also be mirrored with the same effort to become a valued and productive employee. Lastly, we have a responsibility to ourselves to treat ourselves ethically. Maintaining a healthy lifestyle and learning proper ergonomics will help cultivate a long career. The choice of where we decide to work is also relevant in this context. It's important to recognize our strengths and weaknesses, as well as preferences, in order to choose the most suitable employer. With so many diverse settings and modalities in the medical imaging field, we should have little problem finding a comfortable setting that maximizes our strengths. Before I get to the conclusion, Chris had mentioned that if I'm going to make a movie out of this, I need to include a car chase scene.
Let me see what I can do, sir. You just hold on tight, sir. We'll get you there safely. Looks like we've lost them, sir.
Okay, now that the gratuitous action is over, let's consider the daily life of a technologist and the role ethics play. Well, it plays a role in just about every interaction, decision, and action we make. This significance cannot be overstated. A patient's perception of medical imaging in its entirety can be shaped by just one experience with one technologist. Approaching our workplace with the same ethical considerations as we apply to the patient helps create an open and positive atmosphere. Aspiring to follow the codes of ethics every day with every patient is the best way to fulfill the desire to have a satisfying career while making the greatest impact on our patients' lives.